My name's Andrew Swanson-Dobbs and I'm the CEO here at WellSouth. And recently, Dr. Carol Atmore and myself did a road trip around the region, visiting practices and having wonderful conversations with general practice teams about the activity that we are doing at WellSouth and making sure we are connected to the voices of general practice and what you were saying to us. So for those that weren't able to make it to one of those presentations or discussions, I'm going to give a short overview of what was in the presentation slides, and hopefully it is able to be clearly understood. If not, give us a call, give us an email. We'd love to hear from you to happily explain more what's in this PowerPoint. So I'll flick through. Recently, the board came up and revised our vision, purpose, and values. And it's really important to reiterate this so that you know what our focus is as an organisation. We are determined to get the best health and well-being for the southern communities, and we know that we need to empower and support providers to deliver those services. Our values certainly remain about equitable, respectful and transparent and whānau-centred services. We have a strategy on a page. It's on all the walls in our office, and it drives the direction of activity and focus for the staff in this organisation. The aims and strategy are up there for you to see, and about partnership and relationships, using our resources wisely and positioning ourselves in the middle of our health reforms to make sure we support general practice and primary and care providers to be well positioned. Listening is one of our strategies. That's one of the reasons we've gone out on our road trips to the practices and to the providers to listen to what's key in your world right now. Equity. Equity is a huge focus of the activity that we do and the activity that we know you are doing in primary care, so it remains one of our key strategies, and I'll address that more during this presentation. Down the bottom is the 6 priority areas for the current financial year that the board wants the management team to really focus on and ensure that all of our activity across the entire WellSouth crew is focused on those priority areas. And I'll try and cover those off quickly now. We have to need to understand and address the causes of inequities in our community. We know the health statistics and the areas we need to focus on, but we need more action on understanding those inequities. Rural health services are struggling. They are in crisis. They need support, and that's a huge focus for us. I'll get on later on to describe the amount of practices and enrolled population that live in rural communities, and I think we have a deliberate priority action area now to support rural health services and find new solutions. We have some wonderful partnerships. We have some wonderful relationships in our community, but we need to develop more and we need to strengthen those that we currently got. Workforce. You will always hear me in any forum talk about the need for pay parity for primary care doctors, nurses and staff with their secondary care colleagues. But we need to focus more on developing the next generation of workforce to be passionate about working in primary care. Part of this conversation today too is about the use of data and technology to assist primary care providers, and certainly that is something we heard a lot during our trip, Carol and I, is about how Thalamus and the work we've been doing over a number of years to bring data back into practices to understand the population has been beneficial. Well, we also now need to talk about AI. We need to talk about all the new technologies out there because that's something you've asked us to do. Working collaboratively with our hospital partners to develop integrated models of care. We have a new hospital being built in Dunedin. We can see everyday progress, slowly, on the new hospital build. However, that business case for that hospital is predicated on more services being done in the community in the southern region. all parts of the southern region. So we need to make sure that we are building those integrated models of care that complement hospital build around our region. Here's an overview of our enrolled population, and what I said before about the quantum of practices and patients that are enrolled in rural practices is evident on the screen. We have 44% of our enrolled population of over 329,000 enrolled patients live in rural communities. That is phenomenal. That is perhaps the biggest PHO coverage area in Aotearoa. So we need to make sure we are focused on rural solutions. Down the bottom left, you'll see the number of doctors and nurses in our region, and that was a topic of conversation around the region is how we quantify doctors and nurses, and it's something that you'll hear more from WellSouth about, because it's okay to have the number of FTE in there, but is it full-time? Is it part-time? How many hours are patient-facing? How many are doing backroom functions or data collection or doing notes? So we want to become more nuanced and detailed in our understanding of the workforce and the activity that they're doing. Here's another screenshot of registers from around the region, and I really wanted to thank all of those that are in the practices that are using Thalamus and involved in the design and development of future Thalamus screens and work that we're doing. This one just shows the overview of the population. Funding. This was a hot topic across all of the presentations around the region. And this one highlights from 2019 through to 2024, which we're only partway through the financial year. But it shows there in 2019, the fee-for-service claims that practices have made to the PHO. As well as all of that, there's capitation. That sits to one side, in and out, through to payments to practices. But this shows the steady increase of claims that practices made during the years of COVID. The blue is COVID claiming, and the green is COVID care in the community. All this funding went through the PHO into primary care to support patients and practices during COVID. But what we've said time and time again is that money is going. 2023 it dropped off, 2024 it is gone. We are now back to pre-2019 expenditure through this organisation. And thank you to every practice that did what you did during COVID and for employing more staff and doing more work. But now the funding, as we all know, is getting tighter. This screen was used during these presentations because it's the same information, but I've removed anything relating to COVID. And it shows 2019, the delineation between the certain programs that are fee for service, and then back to 2023 when it's increasing again, and 2024 again is only partway through the year. So, claiming. This slide from Thalamus shows in the next 30 days what practices could claim from the PHO if those patients that were coming to see you claimed for the activity that was eligible for them. And it's an interesting one for us because the CVRA claiming said there's eligibility of about $800,000 for patients with CVRA eligibility. On our books, we've only got about $200,000 worth of revenue. So we would love it if everyone actually claimed all of the CVRA activity that's out there. Look, you can log on to Thalamus and you can see dashboards like this to ensure you understand what claiming is available to you and your patients. Rural funding. As I said, it's a huge focus of ours. And this slide here is quite striking for us. And in 2015, in the rural population, there was 115,000 enrolled patients. In December 2023, there's 145, which demonstrates a 29,000 patient increase living in the rural communities. But it also shows in the middle columns there the contract value. Now that contract value increased or decreased based on whatever uplift the government gave. And then we divided the contract value by the enrolled population and paid it out straight to practices. And as you can see, the price per enrolled population has decreased. I repeat, this is an indictment of the funding mechanisms in our region, because those patients and those practices that are living in rural communities are missing out on funding. And we believe that if it actually had have kept pace with inflation and everything else, we're missing out on about 1.7 million across the region for our rural practices. So we will advocate for more funding for our regional, for our rural communities. Again, I wanted to highlight one of the Thalamus dashboards. This one's on equity, and practices have access to it, and it shows we are focused on understanding and addressing some of the inequities that you'll see. So look, I just ask, if you've never had a look at Thalamus dashboard but you want to, give us an email. We've got staff now dedicated to coming out to practices and demonstrating the power of Thalamus and what those dashboards can do. And basically it's just a view of your own data for your own patients, for your own practice. One of the other areas I wanted to focus on and thank practices for their endorsement and use of access and choice. We've done a lot of work over the years to roll out HIPS, health coaches and community support workers into practices. And a while ago, we did an evaluation into it, which was a celebration of some of the good things, and that's up on the screen now, and a real benefit to your patients. But it also gave us some opportunities to reflect on what we need to do in the future. And some of those messages are being worked on at the moment, such as funding to practices to host these staff. We understand how tight rooms are in practices, and we are working with Te Whatu Ora on how we can ensure we can pay you for some of the cost it is to have staff in your practice. However, look, there's some really wonderful stats to celebrate for access and choice staff interactions with your patients. We're in over 50 practices out of the 72 now, and there's a considerable number of people have been seen by this program. And the next slide here, 36,000 people have been seen, and over 100,000 encounters for access and choice supporting patients in the 72 practices in our region. It's a phenomenal stat. And I just wanted to say thank you again to those practices that have those staff in your teams. Huge focus for us at the moment, and you'll be aware of some of the hotspots, is after hours. And I wanted to show this one and demonstrate that we are using data to inform the decisions. I have an old saying, no stories without data and no data without stories. Many times we can meet with people who have a belief what's going on, but we can sometimes justify that with data or sometimes challenge that with data. But we're able to see the utilisation of ED departments across the region, and also be able to help figure out what time of the day they attended ED and what region they've come from. And look, if you want to know your own practice's utilisation of ED, we have that information, and we're trying to build a thalamus dashboard for you to be able to see that. Over the years, we've tried to build an understanding of the workforce. This slide here shows the primary care workforce numbers for doctors and nurses. And as I said at the beginning, some of the feedback we've got is it's great to collect the number of nurses, but how many nurse practitioners do we have? Because I think that's an absolute celebration in our region, the number of nurse practitioners. And the number of doctors is clear on there, but you know, for everyone working in primary care, how much of their time is patient facing and how much of their time is doing admin? We've got to try and figure out how to get better at collecting that information, because it's so important to tell the story about the workforce crisis and the challenges of delivering care in our community right now. Celebration of the number of nurses increasing, a real concern that the number of GPs are decreasing. And I think that is just something we were predicting a long time ago, and we're starting to see that occur now. So we do need to actually have better strategies to address that, and that's why our board has set that as an expectation of the team, is to work on workforce development. I won't dwell on this one, but I was just going to show even more of the thalamus dashboards. And again, give us a call. We can give you access to your own information. The changing health environment. This was something we had at the beginning of our roadshow, and it's still evident now. We are not going anywhere. The recent North and South magazine had an article about Minister Shane Reti saying PHOs are here to stay and they'll be boosted. So look, we're not going anywhere. We're staying here and we're getting on with the mahi of supporting you to look after your enrolled population. We are, though, through the reforms, doing much more regional activity. And a case in point was the work to understand and then address POAC. So primary options for acute care, or, you know, there's other titles that we're now using for it, showed that if you were a resident in the Christchurch region, the PHOs there had access to about $11 worth of POAC funding per patient. We've got 70 cents. So recently, through the regional work, we've tried to address those inconsistencies, and thankfully we've got additional revenue coming soon to increase our POAC funding to about $5. So look, Carol's doing a work on a plan to roll out additional POAC services through the region, which is absolutely a celebration. Advocacy for the capitation review. I should reword that to the capitation reweighting review. We are aware that that is underway at the moment, but it is a reweighting, not an increase. And we wait for the budget this year and for an outcome of negotiations to find out what the increase is for funding for general practice. I think we're going to struggle, is all of the messages we're getting from Wellington right now. Rural, I've repeated it at the beginning, I've said it during it, reasons why our rural health services are fragile. They need support, they need an understanding. We've been doing a joint review with Te Whatu Ora for the last year, and thank you for all those. The report will come out soon, and it will highlight the pathway of activity and investment we and hopefully Te Whatu Ora will do in the rural environments. CBCT and localities. Localities are gone, but look, we do need to do place-based planning. We need to understand region by region what we're doing and how we're doing it, and we're working closely with Te Whatu Ora on what that looks like. Comprehensive primary and community care teams, guaranteed funding to next year. We have no guarantees after that, but we'll work with Te Whatu Ora. But thank you again to everybody involved in the rollout of CBCT. And Iwi Māori Partnership Board relationship, we are working closely with them because they have a key role in the future health system, And we want to know what that is, and we want to partner with them in order to make sure that we get it right. Focus for 2024 and on to 2025, advocacy for primary and community care in the Southern region. I've been here for 5 years and I love this region and I'm passionate about it, and I'm passionate about the practices and the activity that they're doing. I hope you've picked up through this presentation that equity is still a focus for us. Māori and Pacific health outcomes are not as good as total pop, and we are going to focus on addressing that. Rurality, disability, we want to focus on the variance that we see in the stats for those regions and figure out why that occurs and what we can do to sort it out. The viability of primary care, including urgent and rural, is a huge focus. And viability for me means both clinically and financially. We have to ensure that the lights stay on and general practice is still functioning in our region. Workforce retention and development, again, is a huge focus for us, and you'll hear more from us about what we're doing in that region. But the last one is just to support general practice to be successful. Thank you for everything that you're currently doing out there in general practice for community right now, and everything else that we continue to throw at you. We do thank you for the activity that you're doing and want to work and partner with you into the future. So look, this was a brief overview of the slides and the discussions that Carol Atmore and I did around the region. I repeat, if you want to get hold of Carol or myself or anyone else at WellSouth to ask any more questions, go through your relationship team or email me directly or call me. I'm really keen to hear from you, connect with you, come and visit your practice, come and visit your community, and figure out how we can help you look after your enrolled population. So thank you for listening, and have a wonderful day.